What is the difference between HATS and MCAS? So HATS stands for hereditary alpha tryptasemia syndrome, which is a mouthful. It is kind of in the same spectrum of conditions as mast cell activation syndrome, but it's kind of different too, because with HATS, the specific thing that makes the diagnosis of HATS is that you have a genetic abnormality that causes a chronic increase of tryptase. So with HATS, the tryptase is usually always baseline is elevated, whereas in MCAS, the tryptase is usually, well, theoretically, in an ideal situation, the tryptase is like at a normal baseline, and then in flares, it increases by 20% or more to make that diagnosis. So HATS is actually one of the rule out conditions that should be considered when a clinician is trying to make the diagnosis for MCAS. Fundamentally, they're different things, although they have kind of like overlap in symptoms. This is another situation where they're not mutually exclusive, which means that you could have both that co-occur at the same time, which is really unfortunate. But usually with HATS, the genes are different, and the issue is with the elevated tryptase that causes more of those anaphylaxis-like reactions. So yeah, sometimes patients who do meet the diagnosis for HATS do also meet diagnostic criteria for MCAS, but usually therapeutically what you would be treating is that elevated tryptase. Because here's the thing in medicine, diagnosis should guide treatment, and when you have a diagnosis of something that is pretty solid, you want to treat that pretty solid sure thing first because you know that it's actually there, versus going after something that you're like, oh, I'm not really sure, but here are things that match. So if you have HATS, then I think it's fair that your doctor is prioritizing treatment on the therapeutics that have been proven to work for HATS. And sometimes these therapeutics overlap too, because the symptoms are and can be pretty similar with HATS and MCAS. If you're curious about all of the rule-out conditions that need to be looked at before a diagnosis of MCAS is made, I also have that online course that has that diagnosis section that is completely free. You can take a look at it. I really go into depth on the diagnosis of MCAS and what conditions you should rule out.